Good morning, good afternoon, and good evening to everyone joining from different parts of the world. It's truly an honor to be here talking to professionals who are all deeply invested in preserving the effectiveness of antimicrobials for future generations. Today, I'll be talking about the role of the pharmacist within an antimicrobial stewardship team, specifically from the perspective of a very large hospital, about 600 to 1,500 beds. I want to emphasize upfront that this is not meant to be a perfect model, nor is it the only way stewardship can be done. This is a practical, real-world description of what pharmacists actually do every day in a highly complex environment. Whether you work in a tertiary referral hospital, a smaller teaching hospital, or are in the process of building a stewardship program, but my hope is that you'll recognize elements of your own practice here and maybe leave with one or two ideas you can adapt at home. So why are we focusing an entire session on pharmacists? It's not because pharmacists work harder than anyone else on the stewardship team, but because pharmacists are often the most consistently present and operationally involved members of the program. In a large hospital, antimicrobial decisions happen around the clock. Physicians rotate, trainees change monthly, and consultants come and go. Pharmacists, however, provide continuity. We sit at a very unique intersection. We understand antimicrobial pharmacology. We review orders in real time. We interact with microbiology data. And we communicate daily with prescribers across specialties. In many ways, pharmacists become the translators, turning guidelines, resistance data, and policy into bedline decisions. And importantly, this role is adaptable. Even in settings with limited infectious diseases physician availability, stewardship pharmacists often become the backbone of AMS activities. Before we dive in, I want to be clear about what we're trying to achieve in this session. By the end of this talk, you should be able to clearly describe the core responsibilities of pharmacists in antimicrobial stewardship, particularly in large hospitals. We'll also explore advanced roles, things that go beyond basic audit and feedback. We'll talk about operational work, leadership responsibilities, education, and research. Stewardship pharmacists rarely do just one thing. Finally, I hope you'll be able to identify at least a few strategies that are adaptable to your own institution, regardless of size or resources. To understand the pharmacist's role, we need to understand the environment. A 600 to 1,500 bed hospital is incredibly complex. Multiple ICUs, surgical, neonatal, pediatric, cardiac, trauma. There are transplant units, oncology wards, hematology services, and highly specialized surgical programs. These hospitals care for the sickest patients, many of whom are immunocompromised and exposed to repeated courses of broad-spectrum antimicrobials.
At the same time, there is a constant influx of learners.
Of course, some medical students, residents, fellows who are still developing prescribing habits. In this environment, antimicrobial stewardship cannot rely on passive strategies. Simply publishing guidelines is not enough. Stewardship must be active, visible, and responsive. And pharmacists are often the professionals best positioned to deliver that day-to-day presence. At its core, antimicrobial stewardship is about optimizing antimicrobial use to achieve the best possible patient outcomes while minimizing unintended consequences. These include resistance, toxicity, and unnecessary cost. It's important to emphasize that stewardship is not about denying treatment or delaying care. In fact, good stewardship often means starting antibiotics promptly when they are truly needed. Stewardship is fundamentally a patient safety initiative. Every inappropriate antibiotic has a potential downstream effect, not just for the patient in front of us, but for the institution and the community as a whole. Effective stewardship is always multidisciplinary. Most programs include an infectious diseases physician, a stewardship pharmacist, microbiology support, infection prevention, and increasingly, data and IT specialists. Leadership support is also critical for sustainability. In many large hospitals, however, the pharmacist becomes the day-to-day driver of the program. While physicians may guide strategy and complex decision-making, pharmacists are often the ones ensuring that stewardship principles are applied consistently across hundreds or thousands of patients. Pharmacists bring a unique skill set to stewardship. We understand pharmacokinetics and pharmacodynamics, how drugs behave in the body, and this becomes especially important in critically ill patients. We also have access to medication orders in real time, allowing us to intervene early. Just as importantly, pharmacists are often viewed as collaborators rather than enforcers. A question like, "Can we narrow this antibiotic now?" is often better received when it comes from a pharmacist who is perceived as supporting patient care rather than policing it. The backbone of stewardship pharmacy practice is daily antimicrobial review. This includes reviewing patients on broad-spectrum agents, identifying opportunities for de-escalation, ensuring appropriate dosing, and recommending appropriate durations of therapy. Individually, these interventions may seem small, but when multiplied across thousands of patients, the impact on resistance patterns, adverse events, and costs is enormous. Prospective audit and feedback is one of the most effective stewardship strategies, and pharmacists are central to its success. Typically, antibiotics are reviewed at 48 to 72 hours once culture and clinical data are available. Pharmacists then provide recommendations, whether that's stopping therapy, narrowing coverage, or adjusting duration. The way these recommendations are communicated matters. In large hospitals, stewardship success depends heavily on relationship building and trust. Dose optimization is an area where pharmacists add enormous value. Patients in large academic centers often have altered pharmacokinetics, renal replacement therapy, obesity, augmented renal clearance, or critical illness. Pharmacists adjust doses, monitor therapeutic drug levels, and ensure that patients receive effective yet safe therapy. This is stewardship at the most individualized level. Formulary management is another key stewardship function. Pharmacists help design restriction criteria, evaluate new antimicrobials, and manage shortages. The goal is always to ensure access when truly needed, while preventing overuse that can drive resistance. Local treatment guidelines are essential in hospitals. Pharmacists often lead the development and updating of these guidelines, ensuring they reflect local resistance patterns and are embedded into electronic order sets for ease of use. Stewardship pharmacists work closely with microbiology laboratories. We help develop antibiograms, interpret rapid diagnostic results, and translate lab data into actionable clinical recommendation. Without this bridge, even the most advanced diagnostics may fail to improve patient care. Education is a cornerstone of stewardship in hospitals. Pharmacists teach medical students, residents, fellows, nurses, and pharmacy trainees, both formally and informally. Every interaction is an opportunity to shape prescribing habits. Hospitals generate vast amounts of data, and stewardship pharmacists often lead quality improvement and research efforts. These projects help demonstrate the value of stewardship and contribute to the global evidence base. Measuring impact is essential, but metrics must be interpreted carefully. Pharmacists track days of therapy, resistance trends, and outcomes, always keeping patient safety at the forefront. Beyond clinical work, pharmacists often serve as stewardship leaders. They advocate for resources, shape institutional culture, and help ensure the long-term sustainability of stewardship programs. Stewardship in large hospitals is challenging. High patient volume, prescriber resistance, and limited resources can lead to burnout. Recognizing and addressing these challenges is critical. The role of the stewardship pharmacist continues to evolve. Advances in analytics, expanded prescribing authority, and global collaboration will further enhance our impact. Pharmacists are essential to antimicrobial stewardship success. Our impact spans direct patient care, education, policy, and research. In large hospitals, stewardship simply cannot function without us. Thank you for your attention and for the vital work you do every day. I look forward to your comments and shared experiences. Remember to hit the subscribe button, to like and share this video widely. I will see you in the next one.